So now that we know the general overview of the diagnostic system, the diagnostic procedures that we have in the respiratory system, I would like us to go a little bit details of what I have just given you. So the first one, we mentioned chest X-ray. Make sure they're not pregnant and remove all jewelries. Let's come to sputum specimen. For sputum, usually they are obtained by two ways. One of them is by coughing, another one is when they cannot cough, then we have to suction the trachea. So let's start with the suctioning. Please pay attention to this because suctioning is considered a skill and it's a sterilized procedure. And so be careful. This cannot be delegated to the UAP. So when it comes to suctioning, how do you suction the patient? I'll take this opportunity to also explain the same way we're going to suction somebody either through the nose to get samples, uh, through the mouth to get the samples. We can also suction, we use the same procedure to suction a patient when they are on trach. So let's come to tracheal suctioning. One, you first assist the client to be in a sitting position or upright position. Sometimes semi-fowler position is okay. Make sure you perform your hand hygiene and then you wear your PPEs. The next is to make sure that you prepare the suction equipment and then turn the suction on. Once the suction is on, the next thing you have to think about is to hyperoxygenate the client with 100% of oxygen. Now you insert the catheter. When you are inserting the catheter, this is where you have to be more careful. You insert a catheter without applying suction until a resistance is met. Sometimes the patient might cough, which is a good thing because the cough reflex is still there. What you have to do is that the time that you have to apply the suction is when you are withdrawing the catheter. But then the suction, another good important thing is that the suction is not continuous. The suction is intermittent. You want to limit your suction to only 10 seconds. I know you will talk about 10, 15 seconds. But when you read Sanders, Archer, and other text banks will recommend 10 seconds. So I would say for the sake of NCLEX, limit yourself to 10 seconds. Then after you finish suctioning, make sure you hyperoxygenate them again because they have been depleted of oxygen. Now, there's one thing you have to know when you finish, make sure you listen to their lung sounds again to make sure that you've not caused any major problems over there. Remember, suctioning is one of the ways to also clear the airways. Apart from getting samples for diagnostic purposes, one of the nursing intervention we're going to be talking about is suctioning. It's very, very important you understand this skill because it's something that you will need, especially when you are working in the medical surgical floor. Oh, almost every unit you will need that. So suctioning is very, very important skill to learn. Now, the other one is when the person can call. In this case, you just have to educate the patient as to how to get the samples. So let's look at this. You can obtain mostly the preferred specimen is the early morning one, but you instruct the client to rinse their mouth before uh, with water before the collection. Again, you don't want to get material from the mouth because that's not what you are testing for. Another one you have to know is that we just need about only 15 ml of the sputum. We don't need much. You will then instruct the client to take several deep breaths and then cough deeply to obtain the sputum. Always collect the sputum before the clients begin any antibiotics therapy. So when a patient is suspected of having pneumonia, especially bacterial pneumonia, and then they want to figure out what bacterial is causing it. General rule, usually they will start the patient with broad spectrum antibiotics because they don't know which organism is causing this infection. When that happened, the provider will order a culture. Once you get the culture, you can go ahead and then give the broad spectrum. If the organism is identified, then what is going to happen is that they will now switch the antibiotics and give the antibiotics that is more specific to the identified bacterial. I hope you understand this concept because it's something that they test a lot, and you will also need it, especially in your new generation questions or the case studies. All right. So, what are some of the risk factors to consider when you want to suction the patient? One of them is going to be smoking, surgery, chest X-ray, and allergies. Now let's come to laryngoscopy and bronchoscopy. What is it? This is just a visual examination of the larynx. I already talked about it, the trachea. So if it is a larynx, it's called laryngoscopy. If it is trachea, it's called tracheostomy. And then when it is a bronchi, we call it what? Bronchoscopy. And if they are going to visualize wherever they want, if it is a colon, they'll call it colonoscopy. So when you hear any of the scope, think about camera. And then with this one, when the patient is going, especially when they're going to do the scope, because they are going inside or yeah, they are going inside you, especially in the airways, please you maintain the patient. The person has to be NPO before the procedure. Because if the gag reflex is still there and something is the stomach, when they gag, they can aspirate themselves, so it becomes a safety concern as well. You want to assess the results of coagulation studies. So when you talk about coagulation studies, what is it? This is a study that is done to determine the ability of the blood to clot. So if the platelet levels are low, you need to notify the provider that, hey, I know this person is going to do a procedure which involves some kind of bleeding. Are you going to, no, yes. What are we going to do? So what you need to understand is that we need to assess these coagulation studies to help us make sure that we are safe to carry on what we are doing. Let's look at the next one. You want to remove every dentures and eyeglasses. You want to establish an IV line. With LPNs, you just assist with that of the RN to establish a new line. You always want to get an emergency resuscitation equipment available at all time, especially when we have respiratory problems. Now, after they come back, that's what we call the post procedure. In this case, you want to maintain the client in a high follow position for the lungs to be able to expand. And then you also want to make sure that you maintain them NPO until the gag reflex returns. Now, if the gag reflex is not back, you cannot give them anything to eat. The reason is that you give it, it might be going into the wrong way because we don't have any reflexes to defend. That mechanism is being taken off now. What are some of the complications? One of the complications which I already mentioned is called bronchospasms. Then we also have bronchial perforation, which will cause injury to the bronchioles. We can even get pneumothorax, and that is a more complicated one. We want to always notify the healthcare provider if signs of complications occur. And yeah, those are the things that you need to know. The next one is the angiography, which I already explained. This involves, so here we're talking about, sorry, angiography, pulmonary angiography. Now, pulmonary, what do we talk about? Pulmonary is nothing but what? Um, we're talking about the pulmonary system, which is the lungs and then the airways. So when you hear angiograph, meaning that angio is going to have some dye procedure, graphy is going to have some X-rays. So when you hear pulmonary angiography, this is where we inject air, sorry, we inject iodine or a contrast, and put it that way. That makes a lot of sense. We inject the contrast material before images are taken. So again, angio, please remember, is a dye procedure. David speaking. All right. All right. So this is pulmonary angiography. This involves an injection of the iodine or an opaque radio contrast materials before the images are taken. Now let's look at the pre-procedure. Assist the clients to okay. We're gonna end it here for now. All right. Sorry about that. Okay. So let's talk about pulmonary angiography. When we talk about pulmonary angiography, we're talking about the pulmonary system, which is the lungs and then the airways. Angiography means that they will inject the air, the dye, or the contrast before the images are taken in the lungs or the airways, and this usually enhances the images that comes out. Now, like I said before, this involves injection of iodine or radio opaque contrast materials before the images are taken. You'll be the nurse. As a nurse, you are the one to prepare this patient for this procedure. In this case, you have to assess for allergies to the iodine, allergies to seafood, and radiopaque dye. Um, Sometimes the question will say, what is your previous reactions to, I mean, have you had this procedure before, and what was your reaction to the dye? Usually, if they have anaphylactic reactions, this will not be a very good idea to go by this kind of, to repeat that. Sometimes, if it's not a serious problem, they will have to give the person steroids, or they will give the person Benadryl before the dye is being injected. Now, you also assess results of coagulation studies because when the patient have problems with bleeding, like low platelet, you have to let the doctor know. You also want to make sure that there's an IV access that is always there. This is the standard that we do, so that in case of emergency, this is not a time that you are going to be chasing things. He wants to instruct the client that he or she may feel the urge to cough, or they'll have this flashy feeling or nausea, or they'll have a salty taste during the injection of the dye. You're just giving them a heads up. Then always have an emergency resuscitation equipment available just in case. Now, when they come back from this procedure, you want to always make sure that you avoid blood pressure from the site uh, where the contrast was injected. It's all because we don't want bleeding to take place or bleeding to occur in that place. Usually they use a very big vein, so that's why we try as much as possible to avoid bleeding. You also want to assess what they call neurovascular assessment, peripheral. So peripheral ones, you're doing monitor peripheral neurovascular status. This is where we are looking at the color beneath the extremities or beneath where uh, the injection site was. We're looking at the color, numbness, and then tingling. If any of them happens, then we say that uh, if any of them go wrong, then we know that no, something is not right and we need to investigate it. You also want to assess the insertion site for bleeding, which that is why we did the coagulation studies before, and make sure that you monitor for reaction to the dye. That's the main thing when it comes to the dye procedure. Now, the next one I'm going to talk about is the torosynthesis. So when we talk of torosynthesis, is the removal of fluid or air from the pleural space. Um, from the pleural space. That's all that torosynthesis is all about. Now, pre-procedure, you want to position the client in the sitting position or upright position with the arms and shoulders supported by a little table at bedside during the procedure. Usually, the fancy word that we say is a tripod position. If the client cannot sit up, the client is placed laying in bed towards the unaffected side. So they can be in bed and then, but they have to be on the unaffected side with the head of the bed elevated. Do not forget this. This is very important. They can ask a lot of questions on that. After the procedure, you want to monitor the respiratory status. You also want to apply a pressure at the bleeding site and assess the puncture site for bleeding and crepitus. You also want to monitor the signs the signs of pneumothorax or air embolism and pulmonary embolism. All right. So now that you know what photosynthesis is, the other synthesis that I want you to remember, which will come in the part, which will come later in the preparation, is what we call pericardial synthesis. In this case, this is where the fluid was built in the pericardium layer, and then they went and inserted what do you call it, a catheter and aspirated the fluid. Now, when it comes to the other synthesis, is called the parasynthesis. This is where the person's liver is impaired and then fluid begins to build up in the belly. Again, one of the ways to solve that is to drain the fluid. And so always remember um, always remember anything that you can connect whilst you're learning, make sure you connect that. All right. So let's look at pulmonary function test. Now, the pulmonary function test is used to evaluate lungs mechanisms, gas exchange, and acid-base disturbances through what we call spirometric measurements, which is the lungs volume, arterial blood gas levels. Okay, I'm not going to put too much emphasis on the pulmonary function test because this is not a test that is mostly tested. We don't do that much. Now, when talk of lung biopsy, this is where we take tissues for analysis. You have to put the person on NPO, informed consent has to be signed, and then let the patient know that a local anesthetics may be used, and then also apply drainage to the biopsy site and monitor for any drainage or bleeding. Now, with the post biopsy too, you want to monitor signs of respiratory distress and also notify the healthcare provider if that happens. You want to monitor for signs of pneumothorax or air embolism and notify the healthcare provider right away. Prepare the client for chest radiography, or in other words, I would say for chest x-ray, just to make sure that the patient get it on time. Now, when it comes to CT is nothing but CT also is an X-ray, but the problem is that this time around they are going through the machine, and the machine can take the X-ray from three different dimensions. And so CTs are a little bit powerful compared to the X-ray, but it's also part of the X-ray. Now, before somebody goes for the CT, assess whether they have had their experience before. If not, you want to probably take note of that. Then again, frequently used tests to diagnose pulmonary embolism. An IV injection of the contrast medium is used. If the client cannot have the contrast, then the ventilation perfusion scan is the one that is our last option. So what is ventilation perfusion scan? It's just a scan to determine if there's any blockage in the airways. We're talking about perfusion scan evaluate blood flow to the lungs, and also we're talking about the ventilation scan determines the patency and of the pulmonary airways and detects any abnormalities uh, in ventilation. A radionuclide may also be injected into the person's procedure. So CT can come with a form of contrast or no contrast. Let's come to the assessment. You want to assess the client for allergies to the dye. We've already talked about that. Remove all the jewelries and then also review breathing methods that may be required during testing. And also, we want to establish an IV access, administer sedation if needed, especially when they are claustrophobic, and then also have emergency resuscitation equipment available at all times. It's all about safety. Now, when they come back from this procedure, you monitor the client for the reaction of their, sorry, we monitor the clients for reaction to the radionuclide or whatever uh, contrast that was used. You also want to instruct the client that the radionuclide may clear from the body in about 8 hours if they are well hydrated. The last but not the least that I'm going to go into details is the skin test. A skin test is a skin test uses an intradermal injection to help determine to diagnose various infectious disease, and one of them is going to be the TB. So let's look at the skin test first. The procedure: determine the hypersensitivity or previous reaction to skin test, and that is why I told you that before you give somebody a TB antigen, ask them if they had a BCG. Some of us, we had a BCG before coming in here. Because we have it, we'll always be positive. It doesn't mean that we have an active TB going on. You want to use a skin site that is free of excessive body hair and also dermatitis and blemishness. All right. So let's look at the other parts. When they come back, make sure you apply the injection at the upper third of the surface of the left arm. Circle that area and also let them come back in the next, I think, 24 to 72 hours. So document the date, the time, so that this and the site. Advise the client not to scratch the site, prevent infection and possible abscess formation. Instruct the client to avoid washing the test site area. Interpret the reaction at the injection. Interpret the reaction at the injection site 24 to 72 hours after the administration of the antigen. So you want to also assess the test site for the amount of duration, the amount of induration, which is the heart swelling, and also in millimeters, and for the presence of erythema and also vesiculation. So that is how TB is tested. Now let's come to arterial blood gases. This is where we'll be doing some kind of practice as time goes on. This measures the amount of dissolved carbon dioxide and oxygen in the blood. It is also a way to determine whether we are having hypoxemia or low oxygen in the blood. And usually what we get outside is more great. The last one I'm going to talk about is the D-dimer test. The D-dimer, what is it? All D-dimer tells is that there is a formation of clot somewhere, or there is a breakdown of clot somewhere. As to where it is not able to tell. But definitely, if it's a positive sign, that's a very good thing because this patient could have gotten a clot, which this test is going to bring up. If you have any questions, this is a very good time for you to ask the questions. But other than that, I will let us pause here a little bit so that when we come back, we'll look at the treatment options that we have in the respiratory system.